Is good, you guys. Welcome to another episode of That Random Podcast Person. So, today on the show, we'll be talking about depression. Yes, you heard it right. The most underrated and the topic that is not given its due credit and importance. So, today on the show, we'll be having a senior medic expert, Dr. Arun John, who has an astonishing 40 years of experience in medical sciences. And with that, we'll be having some talks with my friend Shikhar Saraswat. He'll be telling his story about anxiety. And not talking more, let's get into the conversation and let's get started.
First of all, thank you so much again, sir, for taking out time and joining us on the podcast. So, to our viewers who do not know who Dr. John is, so Dr. John has been in the medical industry for the past 40 years, a massive, uh, a massive experience, I must say. So, sir, my first question to you is that what really is depression? Because most of us in our 20s, even I was a year back or so, I was very confused between feeling low, what is depression, and anxiety issues.
Okay, there is a difference between anxiety and depression. Anxiety is like I am going to give a podcast where I'm going to participate. So my anxiety would be how will I feature? Will I get connected? These are questions of anxiety, which are short-lived anxieties. An event or something leads to anxiety, whereas depression is something else. See, the first step to depression is sadness. Now, let's take you are a Kings 11 or you are a Mumbai Indian fan, and Mumbai Indian lost. Okay, you are a fan, so that day at night at 11:30 when they lost, you felt sad. Okay, this is sadness. Everyone through the day goes through something or the other where he will for a moment feel sad. I may be sad that I have a flat tire. I may be sad that my gate did not open properly, or my rice did not cook properly, or a lady may be sad because the what recipe she was trying out she could not come. So you feel sad. Now, if this, let's take the Mumbai Indians thing. If you keep on thinking the whole night, that why did Mumbai Indians lose? They should have not lost. This continues into the second day. This continues into weeks. Then you get depressed. So this is a very, very simple or an analogy that you can use to differentiate between what is sadness and what is depressed. People merge the two. They say, I am sad and I am depressed. Sad is a momentarily thing, whereas depression is a continuing sadness. So it's in easy words for a layman to understand. This is that. So if that thought process, will I do well? Will I not do well? All those things, anxiety plus depression. See, before the match, there was anxiety whether Mumbai Indians would win or not win. And because they lost, there was sadness. Now, if this cycle of anxiety and depression keeps on going through your mind again and again and again, this will lead to depression, which will lead to further mental health problems. Easy?
Very beautifully explained, sir. So, as you explained that it will keep on going again and again and again. So, if I ask you that I'm doing all right in my life, nothing is going wrong, I might think about it a day or two, and after that, I'm normal. So, are there chances that I might also get depressed maybe near in the future or 10 years down the line?
Yes. You see, there are different types of personalities people have. There are some people who are couldn't careless to whatever may happen in their life. They are not worried, or they appear to be not worried. Internally, no one really knows what is going inside them unless you sit across with the counselor and then you find out. So, a person who gets depressed or gets anxious or gets sad too often is, of course, one of those candidates who would potentially go into some form of mental health disorder. That is why all these lifestyle coaches and all these people, they say, be happy, don't be sad, don't get into depression, don't go things like that. This is why are all those motivation things there? So that this cycle does not, see, minute it becomes a circular thing. Sadness, okay, depression, okay. The minute it becomes into that, then you are prone to some problem.
Sir, just you mentioned about counselors. So,
Yes,
as I've been in my 20s and speaking about my experience, when I
yes,
was in school, I got to know about the counselor when I was in ninth grade. And still,
yes,
I knew counselor as someone who will guide me through my academics only.
yes.
Later, when I came into college, that too in second year, I got to know what a counselor really does. So,
Hmm.
where are we going wrong? Why have this stigma about depression that, this is something very dangerous? No one wants to talk about it openly.
See, this has nothing to do with health. Earlier, because of the phrase that India used so often, pagal hai, getting that branding on the back of you. Suppose I say, Are, he's a diabetic or he is a hypertensive. Okay? No stigma attached. There is, poor fellow. If I say he's a cancer patient, oh, poor fellow is suffering from cancer. But if I say that my brother is having a mental disorder, then not only is the brother branded, but the whole family gets, अरे ये तो साले पागलों की family है. So it is the society that has attached the stigma to it. So what we are basically saying is that because of the stigma attached to it, people try to sweep it under the carpet. Let's take when Corona came in, people were very scared to even say कि मेरे को खांसी है, मेरे को बुखार है. क्यों? They would say, अच्छा ये बाहर घूम रहा होगा, इस मारे इसको कोरोना हो गया. अब everyone has hit the streets. People are now readily going to labs and getting their corona tested. Okay? See, look at the same stigma. Every disease goes through. Look at the stigma that AIDS had. When AIDS came in, everyone said, AIDS, 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 AIDS. Now, if you say that this guy is an AIDS, यानी उसको आदमी लोग पानी का ग्लास नहीं ऑफर करते थे. आज the guy who is an AIDS patient may be working next to you because we know there is a cure. So what we are trying to do in all our campaigns is say that mental health is a disease like diabetes, hypertension, cancer, which is treatable. Which again, like we say, agar you find diabetes early, if you find pneumonia early, you can treat it. Suppose you have a wound in your leg and you treat it early, it can be treated before wo nasur ban jaye. So what we are saying is that if it is caught early, everything in the medical field is, if you catch, all the efforts in the medical field is what? To catch a disease in the early phase. Because if you look at classification of diseases, there's stage 1, stage 2, stage 3, stage 4. Every person in this world knows this, about the 4 stages of disease. So what we are saying is, if you catch it in stage 1 or very early, आज मेरे को जुकाम होता है, सबको क्या मालूम है? एक जाके एक एंटी हिस्टामिन खा लो, एलेग्रा, सिट्राजिन, कुछ चीज खा लो. क्यों? इससे पहले मेरे को वो जुकाम जकड़ ले. The common word that is used in, मैं स्टीम ले लूंगा. मगर अगर मेरे को डिप्रेशन है तो मैं 1 महीने के बाद तो पहली बार किसी से बात करने जाऊंगा, और जब मैं उससे बात करने जाऊंगा वो भी ही लुक एट मी, अरे इसको क्या हो गया यार. So we hide that disease or the malfunction of the bodies for so long that it has really gripped you well by then. And then you have to go through counseling, you have to go through medication or a combo of counseling and meditation. Then the system becomes large. What you could have been treated in 15 days goes to 6 months, maybe a year, and then repeatedly, you will have relapses. Like if you let's take simple thing, like if you have leukemia, you catch it early and you are treated. Then your remission time, that means when you are free of the disease, are longer. Same. This is also same. You catch depression early, you go through a counseling, or you maybe need a small amount of medication for a help, and you are out of it. And therefore, you may be free of it. What you said now, you can repeat again. Yes, you can repeat again. But so what? Don't I get cold every second or third year? Don't I get diarrhea every, once in a year or twice because I have gone and had samosa somewhere? Or I've had a meal in a restaurant which has not been very clean or something or the other. But there is no stigma attached to a diarrhea. Okay, fine, I had diarrhea. Probably I'll have those medicines at home. I'll have it, or I'll call up a doctor, or even go to a pharmacist. He'll give me 2 things. So if you can approach a chemist, if you can approach a friend, no one is afraid of telling to his, boy sitting next to him or a colleague sitting next to him, यार मेरा पेट खराब है, मेरे को लू जाना है. But कोई ये नहीं बोलेगा मैं डिप्रेस्ड हूँ यार, मेरे को कुछ तकलीफ है, मेरे को कोई वो, because of the stigma attached to it. So what we are now, but really I'll tell you the fact, the world is opening up. Now people are realizing that this is nothing to hide. Speak. There are so many forums like yours where people are saying, speak, talk. The more you talk, the better you are. See, this is a pressure cooker effect. If your thoughts keep on increasing, the brain is this big, like a pressure cooker. Okay, it can accommodate so many thoughts per day. It can, analyze, do work on so many things. But if you keep on doing it, it goes beyond it. And if you don't have the whistle to go off, then probably your pressure cooker will burst. So what we are saying, the counselors are those in front of whom you can, release them. You must have seen your mother many times release the thing, steam. So that's what we are. The counselors are, that's what they do. They help you release your steam so that there is no blast effect that may happen to you.
Beautifully explained, sir. So, sir, as you said, if we get to know about this thing earlier, we will require a significantly less amount of time to get out of it. So
Yes.
my question is, if, for example, say I am suffering from depression, how will I be getting to know that, okay, there is something wrong with me, I need to seek counseling? Or as a friend, what should I be doing? What should I be observing that my friend is suffering from something, and I should be the one stepping up and telling him, dude, you need to take counseling and there is nothing wrong with it.
Okay. When we started the helpline about 14 years back, if you went on the internet and tried to search, you would find nothing. Help was not available. And that is where the idea of doing a 24/7 helpline came to us. What happens? See, if I am depressed and I go to the emergency of, let's take any hospital that is close to you, will you get a psychologist at night at the emergency room? You will get a surgeon. You'll get a physician, you'll get an orthopedic surgeon, you'll get all the super specialties. But go and ask him, can I talk to a psychologist? The emergency room people will look at you. Kya bola? Phir se bolna? That is the, no hospital has a duty rota for psychologist or psychiatrist. They are all on what you call on call. Okay? So, when do most of the panic attacks or severe bouts of depression, when do they come? The whole day I am in an office, let's take. I am in a school. I am in a workplace. Ye kaam aaya, wo kaam aaya. My mind is busy. I go home, I have dinner, I go to retire, or I sit in front of the computer. And that is where my mind starts to process. Okay? So, usually on our helpline, I'm saying a live thing. Our helpline, Maximum calls are between 10 p.m. to 2 a.m. because that's when a person is the time when the person is alone, and this thought process becoming rapid and rapid and rapid he goes into a depressive mode, or he goes into a panic mode. And then who does he call? His friend is, he will hesitate to call his friend. He can't go and seek a help or something like that. So for that was the time we basically devised our helpline. That when these hours, when would a psychologist or a psychiatrist next be available? Probably 9 a.m., 10 a.m., 11 a.m. when they all open their clinics, or hospital OPD start working, whatever. So there are basically a gap of about 11 or 12 hours, which is a blank period. So we first thought we'll cover that. Then, like Mumbai was hit by floods. There are natural disasters that play. Riots are there, curfews are there, where you can't go. Of course, when we designed the helpline, we had never ever thought of pandemic. This is something new that has come to us, where people have now for so many months not been able to go and contact. So from a crisis intervention helpline, we have become a helpline which is actually servicing people. What would they be doing in a real time, normal life? Going to a psychologist, meeting them, going to a psychiatrist meeting. So we have become a secondary mode of seeking help. Okay, we were always a secondary mode of seeking, but now slowly we are becoming the primary mode. So that is where the helplines are coming. Now, like you said about school, why do schools have? Because children, they may not be free to talk to their parents. They may not be free to talk to their classmate. So who do they go to? Okay, he doesn't have money. He has money in his pocket to probably eat 2 biscuits outside or something with that. Someone sitting outside the school may be selling, or maybe have a thumbs up or something outside. That's all. But he doesn't have money to go to a counselor. That's why we made the school counselors available. People started doing this pro bono so that people could, kids could go and accept them. So this is the reason why counselors came and became important. Because let me tell you, age-wise also, we have had small children of the age of 8 years call us. Can you imagine? This boy had seen, we had done a seminar in their school, and we had put up this posters that if you're worried about exam or something like that, call the helpline. Now this young guy, this young boy, maybe 8 or 10 years old, this guy saw that, okay, and he remembered the number. So he called our helpline. We were very surprised. The girl on the helpline took the call and she started talking to him. She says, why are you calling? No, I don't want to go home. So, very lovingly we asked the boy, why don't you want to go home? My mother told me these 3 maths questions, you remember, exercise, do it again and again, because these are important questions. I wanted to play. So I told her, yes, I have practiced them. Now, as per her word, those 3 appeared in the exam. And I'm 0 on it. Now, when the result will come, the teacher will show my copy to my mother. And my mother is going to give me a spanking. So I'm not going home. So we, the counselors, they started talking to her lovingly, then found out the mother's number, which school, we called the school, we found his name. So the school people went, there was a park nearby from where he was calling, because nowadays all kids have a mobile phone. So their mother and father went to there, and then they brought the child. So I'm saying they are that young people. And there are people who are of the age of 80, 70 who call us. किस चीज के लिए? They'll call us in the morning times. बेटा आप लोग 24 घंटे काम करते हो? हाँ. मैं आपको 10:30, 11 बजे के बाद कॉल करूं? नहीं माता जी, आप क्यों हमें करना मत? बेटा उस वक्त मेरे को बहुत अकेलापन लगता है. मैं किसी से बात करना मांगती. So this is the other spectrum that a counselor is dealing with, wherein there is an empty nest. Children are all busy. There is no one to listen or even hear the old people. So that's what we are working for. Now let's take school-going children. School-going children, when do they call us? when the exam fever starts off. It's usually in January.
January, February.
Yeah. सर मैंने आज पहली बार किताब खोला, मेरे को तो मालूम नहीं था कि इस किताब में इतने चैप्टर हैं. ये 2 महीने में मैं कैसे करूंगा? These are very common, you will laugh, but really these are calls that, इस book में इतने चैप्टर थे. The fellow has been having a ball of a time. Him or her has been having a ball of a time. Now he's worried. So those are the things. Then there are people who are, who always dream that I'll be first or second, who always dream of the 100th percentile. I did, the sample questions and I got 99, correct. I missed out one. He's worried about that one. So, there are those perfectionists. There are those who are absolutely percentage or percentile minded. So those are the things. Then when the exam comes, people will call up and say, sir, कल रात तक तो मेरे को या 1 घंटा पहले तक तो मेरे को सारे फॉर्मूला याद थे फिजिक्स के. अभी मैं सब फॉर्मूला भूल गया हूँ. अब मैं क्या करूँ? So they are then when results are coming out, मेरे हिसाब से तो इतने आने चाहिए थे मगर इतना आया. All the self assessments have been done. And my mother and father had paid for tuition fees. Now then I wanted to join this college. I cannot join this college. So all these calls come. Then of course is the age group that goes to work. There are peers. मेरे को promotion नहीं दिया, उसको pay rise दिया, मेरे को नहीं दिया, उसको preference देते, मेरे को नहीं दिया. Those problems you would have heard. And obviously that is the age group that my office girl, she is interested in me. I'm interested. She's not responding. My girlfriend is not responding. My boyfriend is not responding. Then come the, working time, financial issues. I've taken a role. I don't know, my job will be there. I will not be there. So those people are also there to us. So these are the types of people, who keep calling their friends. So there are multiple things. So, commonly these are the things. Of course, there are those, who say, I have OCD. I've been schizophrenic. I've been advised therapy. I'm unable to go for therapy. Can I call you and, do that regularly? Weekly therapy with your counselors? Fine, do it, no problem. We are there to there. And that's why we have an email also. There are currently, the network system, like we were just now, for 1 hour we were down. So what we have said, that we have an email called help@Vandrevala Foundation. If you are unable to, contact our helpline for some reason, be it any reason, we are not ascertaining any reason, just mail us, share your number, and we are probably the only, maybe, the helpline that calls people back. So we let people call back.
So, sir, coming to the Vandrevala Foundation, I read about how you and the government of Maharashtra both work together in, improving mental health care. So, other than working with government of Maharashtra, have the Vandrevala Foundation come up with any strategy to work on the national level also?
Well, we have worked with the Gujarat police for the last 7 years. We have been working. Of course, it is not updated on the site. We set up helplines in Gujarat and we are helping. We do, our helpline number is available on the hall tickets of every university, every college, every school. All the major corporates which are there in Gujarat have our helpline number on their things. So we have done a lot of, anti-stigma and awareness campaigns in Gujarat. When the question that you are coming to is why we have the number which is an all India number. Though we are an all India number, but we still have problems because though we would want to service, a person who's, counseling is best done in mother tongue. So I would rather be happy that I have a counselor on my helpline who, if a Telugu Andhraite or a Telugu speaking person is calling, can talk to him in Telugu. Or a Tamilian is calling, or Malayali is calling. So what we have done in our helpline, what we have tried to do is network with local smaller helplines. So we have system. Like suppose you are a Tamilian who is calling. So we have a system wherein we can share you the number. This is the number because they may not be available like us 24/7. So this is the number you call, or if they are calling in the time when that person is available, we will patch the call to them. So we say, okay, this is the number, just tell them. And most of these people have agreed to be very gracious, to be doing it free like how we do. We don't charge. There are a lot of people who charge for calls, they charge for chats, they charge for email, but we think, no, it's not correct, because people who have been in the, afflicted with some mental health problem are usually not very, very financially well off. So, we don't want to burden them in any way, as far as possible. That was our thought. And that is why on our helpline, we thought, no, we just don't want to. You see, there are two parts in counseling. One is what is called the listening skills, and the other is counseling. Lot of helplines work on listening skill. Listening is also a very major important part of counseling, because it lets the person vent out. So those helplines that work on the listening pattern, there are a lot of patterns that are usually there, that where a counselor is trained. You have a problem, you just keep on telling me, talking, and I say yes, okay. So you let the pressure cooker whistle go off. Now, how do you not make the pressure build again? That is counseling. And that is basically done by psychologists who are MA, who have done their post-graduation, because it takes 5 years to learn. Counseling, a lot of people think is like giving tips. A lot of people write to us, can you give me tips on how to get happy? I don't know where they get that from. So basically counseling, now there are helplines that work on volunteers, but we don't want to much go on to volunteer system, because they're not psychologists. Like, you can also, do counseling, but can you give the real, because after all, when a subject has been devised of MA in psychology, obviously there is a protocol, there is a curriculum that you have passed through. You understanding my point? That is what we are trying to say.
So, sir, in the past few years, we've seen that technology has been on a boom. If we compare it to, a decade back, a year in technology advancement now is almost like covering a decade in the last millennium. So the number of people talking to you, the Vandrevala Foundation. What do you think the social media has done to the youth or any age group? Has it benefited more, or has it created subconsciously that the difference, they do not get the difference between the real life and the real life? They often fantasize that I want to get this, I want to get this. So
Yes.
they are constantly obsessed with it.
Yes. Okay. Let's take the technology part. We do work on a very good technology, but since this pandemic, and we having to leave our office and start to work from home, actually an hour later at about 2:30 this afternoon, we are talking with one of the technology giants who has already done a lot of presentation, wherein we will be able to, in lifetime, like I or my two supervisors will be able to in lifetime track what our counselors are doing. Because earlier in the office, it was very easy, you could hear, you could do, but this pandemic has changed, and we don't know when it is going to go off. So how long? So the people also worked, and in the last 3 months, a lot of companies have done a lot of research, because they know this work from home business is going to be in. And one of the technology giants, they approached us, and maybe in a week's time, we will go into a very advanced technology. Why we are opting for that is because currently we have got about 9 counselors who are taking the calls. Now, we do about 200 calls a day. Now, if what we have been told by the people who manage our website is that there are about 600 people that hit our website. Okay, 200 call us, 100 about mail us. Where are the other 300 gone? No one visits a mental health site for fun. Okay, no one types I am depressed or I'm suicidal or I'm in great anxiety or I'm feeling really down to the earth. No one does that. How many people will do searching the net? So what we presume is we are losing. See, there may be people who may not be able to garner strength to call us. Okay, or there may be people who may not be able to call us. There may be a telecom problem, network may have issue, हमसे connection नहीं जुड़ रहा है, problems हो रहा है. So we are trying to get these, whoever has even tried to call our number will be coming to us, and a supervisor will get in real time such and such number was. So since we have decided, and it's a policy of the foundation that we will call back, the supervisors or the senior counselors will be shared these numbers automatically, and then they can call the person who has approached us. So this is something new that we are going to go as far as technology is concerned, and it will come. Like if you call, let's take Indigo Airlines. They have a IVR system which says that you are busy. In another 2 minutes, the counselor will get free. So at least just now that you have landed on Indigo website or Indigo call center, whereas just now we don't have. Or a flash will come, that this has come. SMS will become. So those are new things that have come in. So we are into that. So that is the technology part. The part that the social media is playing, wonderful part. They are doing a great job, because unless you know that there are helplines, there are things that are available, how do you call? See, if you went on our website, we have said a lot of people know they need help, but they do not know how to get the help. Okay, or they are unable to reach the person who is able to give them some help because of multiple reasons. Maybe network issues, maybe money issues, maybe problems.
So my final question to you is, lately, the youth especially is, going back to spirituality, religion, yogic exercises, etc. So do you think that this can help the person, either remove that hesitation of talking to anyone, or, providing the relief or anything related to it?
No. See, these yoga, meditation, and all have been with us for ages. Why in the last 5 or 6 months people have tried to go to it is for the simple reason they have time now. There is no longer the rat race that they were in.
True.
मेरे को 9-12 की, जो मुंबई वाले हैं, मेरे को 9-12 की लोकल पकड़नी है, मेरे को ये करना है, मेरे को वो करना, वो रेस में नहीं है. So if my counselor earlier told him that you join a yoga class, he'll say मेरे को लोकल पकड़ने का टाइम नहीं, तो योगा क्लास की बात करता है. So these are what we always say, these are alternative therapies, and they have a certain amount of role. All these alternative therapies do have a role, because if I tell you to meditate, okay, I tell you to meditate, will you meditate? No, because probably 6 months back you did not have the time to meditate. सुबह सोचते हैं कि शाम को करेंगे, शाम को सोचते थे कि दोपहर में करेंगे, दोपहर को सोचते थे कि रात को करेंगे, मगर वो होता ही नहीं था. आज that man has time to do yoga, maybe see a video and do yoga, or maybe learn how to do meditation. Maybe I may see today. I'll tell you, there are so many people that we have had. We are so happy, sir. We are now seeing the positive effects of pandemic. What, sir? आराम से बैठ के IPL देख पा रहा हूँ. There was a time in the first 3 months that people said हम टीवी देखते ही नहीं है क्योंकि हमारे को उसमें कोरोना के अलावा कुछ दिखता ही नहीं. इतने मरे, इतने बीमार हुए, इतना ये होता है, ये होता है. आज मैं कोरोना को छोड़ दिया, टीवी वाला चैनल नहीं खोलता हूं, बट मैं शांति से आईपीएल देख रहा हूं, which is, look at it, that our adaptability, that we learned कि न्यूज चैनल बंद कर दो. अब न्यूज चैनल वाले भी आप देखिए, they will not talk too much about corona. They are more busy with Sushant, Riya, or the farmer bill or something like that. पहले 3 महीने में कोई भी चैनल खोल लो, 24 घंटे वही कोरोना 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 होता था. So we have adapted ourselves. See, this is exactly what I was telling you in the beginning. If I would have kept on thinking on corona, I would have been in depression by now. But that same guy is telling me 3 months later, I am enjoying because of pandemic the IPL. So thought process has changed. You're understanding what I'm trying to communicate to you?
Yes.
So not everything is bad of a pandemic. People are saying, oh, I have a 2-month-old, I had a 2-month-old baby when corona came in, and I'm so happy that I have been able to play with my child for 6 months instead of leaving it with Ayamasi or someone, or my grandmother or someone, and being worried in the office, how would my child be doing? So probably my mother and father were working people. They didn't enjoy with me that much that I am enjoying with my child. So these are the positive things that people, instead of just thinking, whether I'll die of corona tomorrow or whether I'll fall down with corona tomorrow, they have stopped thinking about it, and it's a positive thing. So this is how a person adapts, and this is where, see, there were 2 channels available for this person. He could have kept on thinking, बाहर जाऊंगा, कोरोना होगा, ये होगा, मैं सब्जी लेने कैसे जाऊं, मैं काम पे कैसे जाऊं. What he is writing to us is, I am now, what he was writing to us or calling the helpline about 3 months back was, I'm scared of corona, I'm scared of losing my job, I'm scared of losing my thing. He is now saying, सर आज तो मेरे को बहुत अच्छा फील हो रहा है क्योंकि मैं आईपीएल देख रहा हूं आराम से बैठ के. There are people who have written to us, it has given me time to learn piano, it has given me time to learn guitars, which I always wanted to do, but I never had time. So the same guy who approached our helpline and had been taking therapy now is going towards the positive side, because we held his or her hand in the time of distress. And that is the role that the helpline fulfills.
Beautifully explained, sir. Thank you so much, sir, again for taking out time and joining us on the podcast. I hope our viewers will, get to know more about the topic of depression, anxieties, and looking at the positives more of any situation. And if they are going through any of the bad phase in their life, they'll be able to talk to someone they might feel comfortable with. Thank you so much, sir, for joining us again.
Thank you very much. Just make sure whoever they know the helpline number. That is very, very essential. Vandrevala Foundation is not important. Helpline number is important. If they know the helpline number, then only they can access.
Definitely, sir. Definitely.
So that was Dr. John, and now we'll move on to the next segment talking to Shikhar Saraswat about his anxiety issues and how he coped up with it. So let's get started with that.
First of all, thank you so much, Shikhar, for joining us on the podcast. And it takes a ton of gut to, tell what you have been through. And depression is such an important topic that we usually do not talk about, and we should be. So, my first, question, or you can say just a discussion. What do you think your depression is?
It depends from person to person. Like it's kind of a personal experience you feel. Maybe merely depression kuch aur hoga, or depression for someone else is going to be something else. So, like if you take the example of lockdown, someone's depression could be like if he is living alone. Yeah, he's या फिर किसी की जॉब छूट गई हो, ही इज नॉट एबल टू बी दैट मच इंडिपेंडेंट, और या फिर डिप्रेशन well starting एंजाइटी से हो बट इट कैन बी टर्न इनटू अ डिप्रेशन थिंग, लाइक फ्यूचर को लेके इस टाइम पे काफी अनसर्टेनिटी है, सम पर्सन वुड बी uncertain about his or her future and he may fall into depression or not able to contact with his friends, may feel that he will leave out of this world, he's not reaching that much potential he have. There are many causes of depression, but it starts from very little things, like you have start from anxiety, you may start from panic attacks, and then when people don't reach out, people start thinking that if we share, people will make fun of this stigma or something, so they start keeping it inside themselves, and then when it piles up for a long time, then it may or may not change into depression. So it depends person to person how things are handled, how things they are going to overcome. That's what is depression.
So,
Depends on person to person.
uh, so yeah, to be honest, I am so baffled by one thing is कि on one hand we we are the only one that are on social media are shouting the this thing is good, this thing is bad, this thing should be discussed more. And on the contrary, we are contradicting our statement by for let's take example recently Sushant Singh sir का example लेते हैं.
Sure.
I was baffled by seeing stories of everyone, please reach us, please do reach us. And to be honest, उसके बाद से I have never seen anyone taking the initiative कि भाई सब ठीक है या नहीं, सब सही चल रहा है या नहीं. Where are we lagging?
Look, the thing is, this world is full of hypocrites, and in this time of social media, everyone wants to come into limelight. अब भेड़ चाल है bro. Like अगर 10 लोगों ने कुछ social media on their Instagram have posted, the 11th person automatically would post it because वो ये feel करने लग जाएगा कि शायद मैंने ना डाली तो लोग मेरे बारे में क्या सोचेंगे. So it's just hypocrisy. They don't want to talk about the topics. They just want to tell people, okay, we are here, we know these things, just. And these things cool down after 2 days. No one was talking about Sushant Singh's murder after 2 days. It was all gone. Everyone was saying, talk to us, talk to me. No, you can't say that, talk to me. You can't talk to 100 people. You can't take the negative vibes of 100 people. Rather than saying, ki, like, okay, talk anytime you want, talk to me. No, you cannot talk to anyone at any time. सबका अपना एक पर्सनल टाइम होता है. Rather than saying it loud on social media, just go to your close friends or basically start from your home. Ask your parents, ask your siblings, ask your close friends, ask your friends whom you feel. Everyone have that intrinsic gut feel कि like ये बंदा suffer कर रहा होगा. He may need attention of that kind of thing, but no, everyone wants to come out on social media and say like, hey, okay, I'm feeling bad for Sushant Singh's death. No, it's just a hypocrite of you. You are not even asking your parents कि वो कैसा feel कर रहा है. How can you like go about someone? Okay, he was a celebrity, and you may admire him, you may not, but you cannot be that much of hypocrite. I feel okay, you may be feeling bad, but just don't go to that level of things कि जहाँ पे तुम खुद इतना weird sound करने लगो कि जो क्लोज पर्सन हो तुम्हारे वही तुम्हें डाउट करने लगे कि ये सच बोल रहे कि ये काफी हिपोक्रेट हो रहा है. So it depends. And now you can see Sushant Singh का केस अब केस नहीं रहा. It's all like a political view.
Yes.
Every political party, everything is like coming down. It's not much more about the social stigma which people started कि depression के against या फिर anxiety by disorder and all. That's all Shiv Sena, BJP, Gangna Ranaut, and Bollywood, and now drug scandal. It's
Uh,
not about Sushant Singh Rajput.
definitely, totally agree. So, Shikhar, it's been I guess 3 years since we know each other, and you know we've been in the same class. We've talked a lot, and
Hmm.
later on in our friendship, uh, most of us got to know that you did have anxiety. So, when was the first time that you got to know that something is going strange, something is going off the track.
So basically, anxiety is you don't know about anxiety when it occurs because anxiety is very common. It may occur to a someone normal person. It may occur to you even like related to when you start podcast, when you released your first show. I'm sure like think कि तुझे भी एक kind of anxiety issue आया होगा कि मेरा पहला show कैसा जाएगा. So it depends in the end कि like how you are able to overcome, how you are able to contact with the person, कि तुम उस चीज को कैसे handle कर पाते हो. Sometimes people are strong enough कि वो handle कर पाते हैं. Sometimes some people need support in one or the other way, whether it's like family being or from their close friends. And regarding anxiety, first anxiety attack I occurred with was in class 12th. Then it was chain of events. But yeah, when I was in my first year, things were coming down to cool because I had started my kind of new life, college life, you can say. That things were novel. But then second year happened, and second year was not that much great, and I had a recurrent attack of anxieties and panic attacks. But it was I was able to control at that time. There's no such big issues that you cannot control anxiety. It's a time being. It takes a time. It will take a time. You will have sleepless nights. But yes, when things become normal, when you stop fighting your brain and start accepting your brain as your friend, this is the key for me to stop having anxiety.
Definitely, that's
That's how I control
also
my.
a very big point. You stop fighting with yourself and accept the situation that you are in. No one's gonna change it, and it will, change it on your own. So the next thing that I want to ask you is, when you initially started to have these anxiety issues, did you seek professional help, or you were, doing something on your own?
I started with my from like everyone started with their own. So I was a kid at that time. I thought कि like ये कुछ नहीं है, normal सी चीज है. जो स्टिग्मा हर किसी के अराउंड होता है, जो अभी भी है कि normal सी चीज है, कुछ नहीं होगा. Let it be, कुछ नहीं होगा. But yes, when it start occurring at a high level, then I went to professional help. I went to my school counselors. I went to professionals. Then I started taking therapies and all. It was a good thing. And I
So
was able to explore much more, which I wasn't confident enough with to talk with anyone. But yes, professional therapies do help you because they are professional. You cannot accept your friend or your family to like just talk and you think कि हाँ सब ठीक हो जाएगा नहीं. तो प्रोफेशनल तभी बने हैं तुम लोग को उस टर्मोइल से वो निकालने के लिए ही बने हैं. उन्होंने पढ़ाई ही उसी चीज के लिए करी so that they can take you out from the turmoil you are in. So yes, I would suggest professional help is way too much better if you think कि तुम्हारी anxiety control में नहीं है or it may cause you future harm. So I would suggest you must go to professional.
definitely. So Shikhar, as you said here, I want to ask here if you had that courage here. I am facing some issues. I need to seek professional help. Doing something on my own isn't helping. But there are still people who are lagging this confidence. They are having that, you know, notion that people will judge them, or there will be parental issues. What will be your message to them?
My message to them would be like what I could say like it's all about the society thing. Like society ने इतना pressure बना रखा है. सबसे पहले we have to kill the stigma कि like people start saying कि ये mental health and all कुछ नहीं होता. It is mental health awareness should be there जो अभी इंडिया में बिल्कुल अब होना थोड़ा स्टार्ट हुई है बट उससे पहले कुछ नहीं था. एंड I know why people don't share. The thing is people don't share because they are way too afraid कि like अगर मैंने इस बंदे के सामने ओपन अप हुआ एंड ऑल तो दे अफ्रेड कि उनको वो ओपन अप होने में बहुत टाइम लगता है. बट जब वो ओपन अप होते हैं एंड बाय चांस दैट पर्सन लीव देम इन मिडल ऑफ नोवेयर, दैट्स द वर्स्ट थिंग कैन हैपन टू एनीवन सफरिंग फ्रॉम दिस इशू। उनको डर, एंड एक बार ये किसी के साथ हो गया, दे स्टार्ट हैविंग ट्रस्ट इश्यूज और वो ओपन अप होते ही नहीं until and unless they go to someone professional. एंड रही बात पेरेंट्स की, सो सबसे पहले पेरेंट्स को भी समझना चाहिए देयर आर काइंड ऑफ थिंग्स जो बच्चे नहीं शेयर कर पाए, दे मतलब बिकॉज हर किसी का बॉन्ड अपने पेरेंट्स के साथ उतना कूल नहीं होता। तो द फर्स्ट थिंग इज, या तो यू आर हैविंग such a great bond with one of your family member, like I have with both my mom and dad, but I prefer my mom, like मेरा बॉन्ड मेरी मॉम के साथ बहुत अच्छा है, तो सबसे पहले उन्हीं के पास जाता हूँ। बट यस, समटाइम्स जब बच्चों के पास कोई ऑप्शन नहीं होता बिकॉज दे आर नॉट एबल टू गो टू एनी वन ऑफ योर पेरेंट्स, तो पेरेंट्स को भी समझना चाहिए ओके कि हाँ ठीक है वो हमारा बच्चा है बट ही इज नॉट, ही और शी इज नॉट दैट मच कॉन्फिडेंट, तो उसे एक प्रोफेशनल हेल्प की नीड है। तो रादर देन जस्ट सेइंग कि नहीं बेटा कुछ नहीं होता ये सब, ये बस खराब बातें हैं, नहीं, ये बहुत कुछ होता है, कैन इफेक्ट हिज और हर फ्यूचर। तो रादर देन दैट थिंग हमें ये सब बंद करना चाहिए एंड सोशल अवेयरनेस स्टार्ट करनी चाहिए फ्रॉम द स्कूल लेवल। आवर एजुकेशन सिस्टम डजंट, इतना तो उन्हीं और मैंने पढ़ा है, नहीं था अपने मतलब इतना सोशल अवेयरनेस नहीं थी मेंटल हेल्थ को लेके। स्कूल में बस एक काउंसलर बिठा दी जाती थी एंड दैट काउंसलर यूज्ड टू बी लाइक हैंडल, क्या ही हैंडल करते थे वो लोग, कुछ भी हैंडल नहीं करते थे। अगर किसी की लड़ाई होगी वो हैंडल करना, मार्क्स कम क्यों आ रहे हैं वो हैंडल करना, उनके लिए काउंसलर सिर्फ यही चीज़ होती थी, बट काउंसलर ये नहीं होती। सो मेंटल हेल्थ सबसे पहले स्कूल सिस्टम से स्टार्ट होना चाहिए। आई ऑलवेज से किसी भी चीज़ का स्टिग्मा खत्म करना है, तो एजुकेशन इज वे टू इम्पोर्टेंट फॉर एनीथिंग। चाहे वो कितना भी पढ़ा लिखा आदमी हो, अगर उसको किसी टॉपिक के बारे में नहीं पढ़ाया जाएगा वो हमेशा अनपढ़ की तरह ही रिएक्ट करेगा। तो येस, इट इज़ द important thing in our society, in our school system, government, and to us also। हर चीज़ गवर्नमेंट नहीं करेगी, इट डिपेंड्स ऑन अस ऑल्सो कि हम उस चीज़ को कैसे आगे लेकर जाए। तो द थिंग इज कि लाइक अवेयरनेस सोसाइटी में होना भी सबसे ज़्यादा ज़रूरी है, तो दैट पीपल कैन कम आउट मोर। एंड द थिंग इज कि थोड़ा लोगों को भी सेंसिटिव होना चाहिए इस मामले को लेकर। दे आर वेरी insensitive, they don't think कि वो क्या बोल रहे हैं किसके सामने, it may hurt, so they need to be sensitive around these kind of topics।